All right. Thank you, Scott, for allowing me to present for the second year in a row. It's already been a great start to the conference. My name is Hillary Plummer. I am a biomechanist and athletic trainer. I currently work at the U.S. Army Aeromedical Research Lab, which is at Fort Rucker, Alabama. And today I'm going to present a study that me and my colleagues did. That's hip abductor strength asymmetry and the relationship to upper extremity injury in professional baseball players. And I would like to thank my colleagues for all their help on this project. This was a multi-year project, so it required a lot of assistance. Let me get that. And my disclosures, this study was funded by Major League Baseball. All opinions expressed in this presentation are my own. And this work was also supported in part by an appointment with the U.S. Army Aeromedical Research Lab through Oak Ridge Institute of Science and Education. So as we all know, upper extremity injuries are prevalent in baseball. In order to try and reduce some of these injury rates that we're seeing, we need to have a better understanding of the risk factors, physically modifiable risk factors that contribute to injury. So that was kind of our goal of this project. See if I can minimize. So what are the hip abductors? If you look at the figure on the right, these are going to be the muscles that attach to your pelvis and then onto your upper leg or femur. And they act to move your leg out to the side. And we know that these muscles are very important in throwing and pitching and hitting as well, as they enable hip stabilization during single leg support. So during pitching with the trail leg, so your back leg, the hip abductors function to lengthen the stride and prevent the pelvis from dropping down. And at the lead leg, stabilization and increased trunk rotation and flexion during pitching. Leg strength asymmetry has been assessed in different populations, not baseball players, and it was found that asymmetry is a risk factor for injury. So this is one of the reasons we wanted to include hip abduction strength into our overall model for trying to better understand screening for injuries and just other physical modifiable factors that are related to injury. So why are the hip abductors important? We talked a little bit about this at last year's meeting. The body functions as a kinetic chain. So as you see in the figure, you have a linked system. So if something's wrong at the foot, that it can have effects up the kinetic chain at the knee, the hips, the trunk, and then ultimately the upper extremity. So if you look at the picture on the far right of the skeleton, you can see that if you start at the bottom, the most distal segment or the most proximal segment, you can see that the foot is collapsed inward, rotated inward, which we call pronation. That causes internal rotation of the lower leg and the upper leg. And also you can see that the pelvis is slanted at an angle, so it drops down as well. And then to compensate, the trunk has to lean in the opposite direction. So why is this important? In pitching, we know that the lower extremity and the trunk contribute about 50% of the total energy to the throwing motion. So if you have dysfunction at the lower extremity or the hip, that could have an effect on the amount of energy that the shoulder and the elbow have to generate in order to make up for any lost energy from the bigger segments. So the purpose of the study was to determine if hip abduction strength deficits are related to the incidence of upper extremity overuse injuries in professional baseball pitchers. Our hypothesis was that deficits in hip strength would be greater for those who sustained an injury, and hip strength would predict injury incidence. So we tested 188 minor league baseball players that were approximately 21 years old. 98 were pitchers, 90 were position players, and our inclusion criteria included that they had to be free from injury at the time of testing, and they had to remain in the organization for the entire season. So if a player was released or traded, we ended up not being able to include them in our final data set because we didn't have injury data for them once they left the organization. So this was a prospective study. Data were collected during the preseason physicals in 2017 and 2018. We did not have access to strength training records. Those were not available to us. So it is possible that strength could have changed as they progressed through spring training and the season. And we did assess history of upper extremity injury as well, because that's a known risk factor for injury. So for our methods, we tested hip strength in a lying position. We used a handheld dynamometer. You can't see the handheld dynamometer very well in this picture, but it's underneath the strap that we have on the table. We typically want to use a strap because that eliminates force from if somebody else is holding that dynamometer in place, they're applying force, so that could mess up some of our values. So we did strap that to the table to try to stay consistent in our measurements. And an isometric contraction basically means the muscle length is not changing. So we'll have them contract the muscle for about 5 seconds as hard as they can, and that muscle length is not changing. Whereas during most movements, you're going to have contractions where the muscle's lengthening or shortening. This time, we just looked at the isometric strength. And we did end up normalizing the strength to leg length to account for any differences between players. So the variable we were most interested in was looking at strength ratio. So to calculate that, we looked at trail leg divided by the lead leg and multiplied it by 100. And then asymmetry greater than 100% indicated that the lead leg was stronger than the trail leg. And for our classifications of injury, injury had to occur due to baseball participation. The players had to miss at least 1 day of practice or game. The mechanism of injury was overuse, so no contact injuries were included in this data set. And the injuries had to occur at the shoulder, elbow, or wrist. Only injuries that occurred during March and April were analyzed because we wanted to eliminate potential bias in our results due to strength changing as the season progressed. So we tried to stay as close to March and April as we could, since we took the measurements in March. So we did have a statistician help us with this project. I'm definitely not a stats expert, but I'll try to do these results justice. He did a mixed effect model to account for multiple records for the same player. So some players were tested both years. So he did try to look and see if there were any interclass correlations between the measures in the players that were tested multiple times. He treated asymmetry as a continuous variable. He ran a fractional polynomial to examine the relationship between injury and asymmetry. And he did a regression model to estimate relative risk for each 5% of asymmetry. So some of the confounding variables that we did look at, age, weight, and height, prior upper extremity injury in the past 1 year, history of surgery on the throwing arm, years of professional experience, and the directionality of asymmetry. So was the lead leg stronger than the trail leg, or was the trail leg stronger than the lead leg? And for the results, we actually didn't have nearly as many injuries as we were anticipating. There were only 18 injuries total. 12 of the injuries occurred in pitchers, 6 were in position players. We do acknowledge that the six position players, we know that's a low number, but we felt like it was important to present that data, even though the findings were small. And what we found was there was no significant interclass correlations in the mixed effect model. So we performed single level models. A fractional polynomial looked at the relationship between injury and strength asymmetry and found that it was linear for pitchers and quadratic for position players. And none of the potential confounders were significant, so they were removed from the model. And breaking it down by pitchers and position players, starting with our pitchers, what we found was that there was a 1.24 times increased risk of upper extremity overuse injury for a 5% increase in strength asymmetry. So as a continuous variable, the 5% increment is arbitrary. So if we have 5% asymmetry, the increased risk of 17%, that increased to 10% asymmetry, the risk increased by 37%. And for 15% asymmetry, the increased risk was 60%. And for position players, there was no association between either absolute hip strength in either the lead or the trail leg, or strength asymmetry and injury. But again, there were only 6 injured players. So getting into our discussion, strength asymmetry may indicate altered adaptations or strength compensation occurring with pitching, and it may contribute to an increased likelihood of injury. So hip abductor strength may be more sensitive metric than absolute strength. When we did look at lead leg versus trail leg as absolute measures, we did not see any differences in pitchers or position players. So the asymmetry between the legs may be the more important metric to look at. And again, there was no difference in position players, but the sample size of injured players may have contributed to this finding. And of interest to note, I did want to bring up history of injury, because in typical injury models, this is a variable that's oftentimes significant, but we did not really see that in our results. So history of injury only changed the risk ratio per 5% asymmetry by 2% for pitchers and 4% for position players. Therefore, we did not include that in the final model, but I did want to present that data because I know that's something people will ask about pretty frequently. And one thing I wanted to talk about, because I think it's where biomechanics, where injury prediction modeling is going in the future, and I think it's we can really marry the analytic side to the biomechanics side, is complex systems approaches. So there's a good article published in British Journal of Sports Medicine by Bittencourt in 2016 that talks about complex systems approaches in injury prediction modeling. And basically, we know that injuries are the cause of injuries are multifactorial, and that injury is a complex phenomenon. So this study really kind of used reductionist methods to look at one single variable, but we do acknowledge that there's a lot of variables that are probably contributing to injury risk in baseball players. So if you look at the figure on the right, you can see that at the bottom, you have a web of determinants. This is going to be basically all the potential factors that may go into why injuries are occurring. So is it a hip strength issue? Is it a shoulder strength, shoulder range of motion, hip range of motion, is sleep, stress? And there could be hundreds of variables that go into a model that could better predict that. But complex systems are open systems, which means they're going to interact with the environment, and they can also evolve over time. So what is an injury predictor for one person at a certain time point may not be the same as they go through their career. It may change. And the pattern of interactions between the variables may not be linear. A lot of times we look at this data from a linear perspective, but there may be nonlinear relationships, and the strength of relationships between the variables may be different. And there can also be multiple pathways to a similar outcome. So like I said, there's a recursive loop, which basically means feedback to the system. So if something happens, the body's constantly getting different feedback, and the variables can change. So I think this is really an area that needs to be looked into when looking at both injuries and also certain performance measures like ball velocity, because there are a lot of factors that are going into it, and the analyses we're doing may not be the best at the moment. So just to wrap up, we know that hip abduction asymmetry was related to injury in the first 2 months of the season in pitchers. But again, the risk ratio was fairly small, even though it was significant. And there's still a lot of work that needs to be done, but hip strength asymmetry deficits may impact pitching mechanics and increase arm stress, which could be related to the development of injuries. So where do we go from here? Future research, we do need to have probably a paradigm shift from linear and reductionism methods of understanding injury to an integrated view of the complex systems approach. So to do this, different statistical procedures like neural networks, self-organizing feature maps, classification and regression trees, Bayesian additive regression trees, and agent-based models may give us better results than what we currently have from an analysis standpoint. And these are my references. And thank you for letting me present today. And let's see. All right, first question. Have we considered replicating the study during some time mid-season specifically to account for overuse within a season? Absolutely, that's definitely was one of the major limitations of why we only looked at injuries in March and April, because we know that there's probably some strength changes that do change. So that's definitely something we want to look in at the future. What was the assumption behind normalizing strength to leg length? We wanted to account for height and potential differences between the players. Are all injuries the result of throwing? Any data breakout for swing related versus throwing? No, we didn't really look at the mechanism of injury that closely. We just looked at, was it overuse or was it due to a contact? If it was due to a contact mechanism of injury, we excluded those from the analysis, but that would definitely be interesting to look at in position players. Does softball pitch mechanics affect injury occurrence compared to that of baseball? That's a good question. There's not a whole lot of research on that area specifically. There's a lot of assumptions made that we do know that softball pitching does have pretty high forces that are similar to baseball pitching, but as far as a direct relationship to injury, that has not been established yet. Would conducting the study in a controlled environment change any of the outcomes, or would there be similar findings? I don't really know how we would do that in a controlled environment. I think part of the benefit of doing the study that we really wanted to do was that it was a field-based study, so we could get more realistic type data by tracking injuries throughout the season. Great methods on a prospective study with a large number of professionals. Any possibility of redoing the analysis, extending the follow-up time period beyond 2 months to include more injuries in the analysis? Yeah, we could definitely do that. I'd have to ask the statistician and then get back to you, Glenn, on that one, but that would be interesting. For future baseball athletic trainers or strength coaches, how do you go about recognizing the kinetic chain injuries? That's a good question. This was part of a larger study where we did also look at lumbopelvic control using a single leg step down task and looking at different joint angles. One of the issues we ran into was that a lot of these guys could barely stand on the box and do a single leg step down, so all of their mechanics were bad. So it was really hard to tie into lumbopelvic stability when everybody had pretty poor values in that regard. But I think that's definitely kind of on our radar of how do we better measure lumbopelvic stability in that sense in baseball players. How do you see the results of this study potentially being utilized towards injury prevention? I think we really probably do need to focus more on the lumbopelvic hip complex and hip abduction strength, but I think motion is also important. A lot of the baseball pitchers that are tested tend to have really poor hip range of motion. So I think that's something that needs to be looked for. And, again, just the ability to stand on one leg or stand on a box, finding better methods to apply that. And this was more of a test to figure out, is there a screening battery that we can utilize to better understand injuries? So there's still really a lot that needs to be done in this area. This was just the first step. Do you think your results would have changed if you would have added players that were traded? I don't think, that's hard to tell. I think our biggest issue was there weren't a lot of overuse injuries to begin with. Maybe it would have. If a player was traded and they were injured beforehand, we did include them in the model. But again, it's hard to tell because once they're traded, we lose access to their injury data. Why were hip abductors chosen versus a more prominent muscle group? That's a great point. We had about 45 minutes. We had to allocate about 45 minutes for all the screening that we wanted to do per player. We would have loved to look at like hip flexion or hip extension. We just didn't have the time to do that. But I think that's a great point, that there are other muscle groups at the hips that maybe we would have seen different results or stronger risk ratios if we looked at different muscles. Was there a point of emphasis in the study to find how much stress the body can withstand to players throughout training and their effort level throughout games? No, we really couldn't measure that, unfortunately. Have differences from the viewpoint of structure of muscles between the lead and trail legs caused those injuries? Potentially, but that's a hard question to answer. Not really sure. Can we expand on strength changes? That would mean like maybe hip strength increases or decreases as a player progresses throughout the year. So if they're lifting weights and that are targeting increasing strength, then maybe that's something that could have affected the model. Was there a common injury that you saw, and what was the total amount of missed days? Let me see. I think I have that. I don't think there was anything that was too common. There were quite a few. There were a handful of UCL sprains. But otherwise, there was biceps tendonitis, a pec minor strain, rotator cuff strain, impingement, ulnar collateral ligament sprain was probably the most frequent, but there were only 3 of those and a couple of flexor strains. If you had access to the strength and conditioning data, would you expect to see similar results with strength, power, asymmetry on injury? For example, counter movement jump and mid thigh pull test. Yeah, that's an interesting question. I'm not sure. That'd be an interesting study to do. Do you think moving between levels in the same organization could affect the data at all? Different travel, different access to weights? Potentially. I mean, it's really, we tried to really include March because we know that's generally spring training where the players have a somewhat consistent schedule regardless of what level they're at in the minor league system, but certainly something that needs to be looked at. For future studies, would you consider a balanced proprioceptive ratio as another variable performing a test, such as single leg stance or some other measure? I think proprioception and neuromuscular control are definitely very important. I think there's a ton of tests that you can do, and we just really haven't had the access to players to build a big enough sample size and look at different tests to really figure out what's the best test to do. But I think the neuromuscular aspect is probably very important. Was prior injury history not significant, possibly due to rehab and strengthening the injured area separate from the hip asymmetry? That's a good question. It could be, but it's really hard to draw conclusions from that. I mean, and again, we really didn't have a large number of injuries, so it's hard to make statements about that. Would you consider college players that can't be traded and are more likely to be overused? That's definitely a good point. Problem with college players, you have to be somewhere where you have access to multiple teams in an area because the rosters aren't nearly as big, but that's a good point. I think I'm running out of time, so I will hand off to Scott.
Dr. Plummer, thank you so much for joining us again this year. That was fantastic.